Flexion, movement resulting in a decrease of the joint angle. Extension, moving resulting in an increase of the joint angle. Abduction, movement away from the midline of the body, usually in the frontal plane. Adduction, movement towards the midline of the body, usually in the frontal plane. Horizontal abduction, movement away from the midline of the body in the transverse plane. Horizontal adduction, movement towards the midline of the body in the transverse plane. Internal rotation, rotation in the transverse plane toward the midline of the body. External rotation, rotation in the transverse plane away from the midline of the body. Lateral flexion, movement away from the midline of the body in the frontal plane. Rotation, right or left rotation in the transverse plane. Elevation, movement of the shoulder superiorly in the frontal plane. Depression, movement of the shoulder inferiorly in the frontal plane. Retraction, movement of the scapula toward the spine in the transverse plane. Protraction, movement of the scapula away from the spine in the transverse plane. Upward rotation, superior and lateral movement of the inferior border of the scapula in the frontal plane. Downward rotation, inferior and medial movement of the inferior border of the scapula in the frontal plane. Circumduction, a compound circular motion involving flexion, extension, abduction, and adduction. Radial deviation, abduction of the wrist in the frontal plane. Ulnar deviation, adduction of the wrist in the frontal plane. Opposition, diagonal movement of the thumb across the palmar surface of the hand to make contact with the fifth digit. Eversion, abducting the ankle. Inversion, adducting the ankle. Dorsiflexion, flexing the ankle so that the foot moves anteriorly in the sagittal plane. Plantar flexion, extending the ankle so that the foot moves posteriorly in the sagittal plane. Pronation, rolling the foot inward. Supination, rolling the foot outward.